give it a little one sentence or whatever? Yeah.
One sentencer?
Just so that, like, because when people are here, if we don't talk about it, it looks like we're just rubber stamping.
I can try it.
It won't be the end of the world if you
I'm sure you know, like the back of your hand.
Yes.
don't. Dot, dot, dot. Good evening, everybody. I'm calling our Human Affairs Committee to order. It is October 16th at 7 p.m. in the Aldermanic Chamber. Seems like my agenda doesn't cover the whole roll call part, but
Do you want me to do roll
Madam
call?
Clerk, would you like to do the roll?
Yes, I will. Alderwoman at Large, Shoshana Kelly.
I'm here.
Alderman Patricia Klee is here. Alderman at Large, Melbourne Moran Jr.
Present.
And Alderwoman at Large, Gloria Timmons.
Alderman Lopez is here as well.
Oh, I'm sorry, Alderman Lopez is here. I'm sorry. You were at the top of the list, and I started from the middle.
I started
And
at the
Alderman
bottom now,
Lopez,
yeah.
thank you.
So we have a couple of agenda items. First up is public comment. Anyone wishing to make public comment, please approach the microphone, give your name and your address. Any comments that you'd like to share? Seeing none. Our next order of business is the presentations we were looking for. So I'd like to invite Amanda up to come and present on behalf of Gatehouse. Anyone else who is expecting to participate, feel free. Come on up, grab a chair, don't be shy. So just by way of introduction to the public, if you check our last couple meetings out, we've been trying to explore some of the different resources and things that the city interacts with to address different needs. Particularly, we've been focusing on sober housing, recovery housing, which one's which, how do these programs run, what does our city do to support them, and how can we continue to do so. So Amanda, if you want to introduce yourself and your organization, maybe give us a summary of what kind of stuff you guys do.
I would.
Oh, just make
No,
sure the
just
mic
get
is
right
pointed
into the
towards
mic
you
there.
and it's a little bit.
Thank you. Is that better?
No,
No.
no, you can bring the mic up to yourself, and you could actually physically pull it towards you.
Yeah, it moves around and super bendy, so
Yeah.
Sorry,
don't be
guys.
shy.
And then always state your name and address of the record.
Yeah.
Business address if you don't want to share your person.
All right. Amanda Robichaud and Gatehouse Treatment, and it is 491 Amherst Street, Nashua. So Gatehouse Treatment is a PHP IOP program right here in Nashua. Typically, we're helping individuals for, on average, about 45 days, kind of navigate through the early stages of recovery. We're not your detox level of care or residential, so we're just below that, which is a 3.5. And we do the PHP portion with housing through our program, so it's a little bit different than other programs maybe in the state. Our sober living is what's connected, and that's where individuals stay with us.
And just as a point of clarification, PHP is partial hospitalization program, and then IOP is inpatient, outpatient?
Intensive outpatient
Intensive
program.
outpatient, sorry, I always get those confused.
I get
So
them
those would look
confused,
like a group that meets for a long period of the day or something to that effect.
Yep. And then we also have what's called the MAT Care Clinic, which is on Main Dunstable Road, 155 Main Dunstable. And through there, we're able to do outpatient opioid and like fentanyl detoxing now for individuals that are either going to drive in from home. They have to have like a stable housing environment. Or we've partnered with like the Nashua Respite, so they're able to go there and also receive those outpatient detoxing services.
And MAT is medically assisted treatment.
Yep.
So just so no one in the public thinks there's someone who's driving on opioids in here, they're part of a long-term program, they have medical supervision, and they're just aiding in the physiological symptoms typically?
Yes.
Okay.
Yep. All right, I'm going to let you lead the discussion.
It's okay. I didn't mean to step on too many things. It's just I try to keep in mind that people who are watching might not have the same background. Gatehouse is pretty big. How large a program is it?
So we have about 150 beds for individuals right here in Nashua. And then we also started offering telehealth services. So we have an evening IOP that runs Monday through Friday from 6 to 9. So if anybody is looking to maybe do treatment services from home, that again is an IOP level of care, so the intensive outpatient program. And that's just an added benefit for individuals who maybe are working all day, they want to go home to their families at the end of the night, they can't do an in-person program.
So citywide, a recent estimate I got from our development office was somewhere around 350 beds estimated in the city. It's a little hard to pin down because not all recovery programs actually feel the need to report to the city or tell us that they're there, or that type of thing. And last month we were talking about how code enforcement typically would have identified a lot of the facilities as something like a boarding house, or we have legislation that if a number of people are living within a facility that aren't related to each other, certain rules apply. So can you tell me a little bit about what the different locations you have might look like? How many people would be in each one? Any interactions with the city you'd care to comment on?
Yeah, so our houses are, they're all NH Core certified, so I think that's maybe where some of the other coding and things like that come into play, and depending on how many people are in each house. So typically, if you're gonna get your home certified in any city in the state of New Hampshire, you'd wanna make sure that you're following rules and regulations from the fire department. So usually you'll have the fire marshal walk through, and they'll kind of just check everything out, make sure structurally the building is okay. They'll let you know how many occupants you can have in there. In some cases, some buildings might need updated sprinkler systems, fire extinguishers, just very basic things like that. Our houses are all, we lease them, or they're leased to us, they're leased to us, so we technically rent them. Mm-hmm. And then what we do is we have about 5 individuals per house for men and women. So we do have gender-specific housing. And that's, I don't really see any non-gender-specific housing in any of the programs I work with. So I think they're pretty much all
So that actually
pretty
might be
straightforward.
a little bit of a gap if you have to identify a certain way. I know we crossed that hurdle only, I want to say 5 years ago in the emergency shelters, where we kind of realized that some people weren't fitting in the boxes we thought they were, and they were basically being shunned out of places inadvertently. So it could be something we look at collectively as a community. When you said core certified, they're actually up to present next month. They were going to come here, but this week there's a little bit of scheduling snafu. Are there benefits or advantages to being core certified?
I think that there is. Because you have to, it's kind of like having a joint commission accreditation in my mind, but for a sober living home. So you know that they're following some structure and some basic rules. Typically there's a bit of programming that falls into it. The guests of that house would maybe go to an outside AA or NA meeting. They're required to do so many per week. They have a job. They're getting urine tested. Specific medications would be locked in a lockbox or a safe so that not everybody in the house has access to them. In my mind, when I make a lot of referrals out for aftercare, I personally try to find the houses that are NH Core certified over others, just because at the end of the day, if somebody's playing by the rules, they're going to be making sure that all their I's are dotted and their T's are crossed, so I can feel a little bit more confident about my client and their experience in their aftercare, opposed to maybe sending them somewhere where, maybe somebody doesn't care if they have extra people in a house or something, that. To me, if you're helping somebody get better, you really want to set them up for the best case scenario in all possible cases, right? You wouldn't want to put them in an overcrowded house. And the NH Core certifications, it prevents them from having that.
So that's encouraging for me to hear, particularly because it was presented to us that they're a major resource that our city points people towards when we encounter places that might not be necessarily in compliance with the fire marshal or code enforcement. And it is a tradition, or maybe a policy of our code enforcement and building inspectors, to be as much educators as administrators. They don't just check you off and then say, hey, go fix your ductwork. They'll try to help you figure out what is needed and why you're getting a certain score or whatever. So it's reassuring to know that the resource that they're pointing at is highly regarded by the providers, particularly one that's represents at least 40% of the beds in our city. So is impactful and has that weight of reputation. What about, are you aware of programs that might be based in other states that operate here? Do you think they have the same kind of desire to be core certified, or?
I think anybody in our space, like typically when I meet with individuals, if it's another treatment facility or a sober living home, for the most point in time, I guess, the majority of them all want to have either that joint commission accreditation or your NH core. Like they want to be doing the things that you can put that, gold star seal of approval on your website that says, yes, we fall in line with all of these different organizations and compliance. Anybody who's not maybe on that list yet, I'm assuming that they've got to be trying to get there. And I can only imagine that some things would take a little longer. Like if you do have to instill a different type of sprinkler system into your house, like those are modifications that the homeowner, I believe, has to cover. That's an expense on their behalf. I don't know if there's funds that cover that for them. Or like a handicap accessible ramps, just things like that. So I imagine that would take time, but for the most part, I would have to say I think everybody kind of strives to get that like gold star seal of approval.
Good. That's, like I said, that's very encouraging, because you would hear from people, on the street or, without like firsthand knowledge, and it kind of makes you wonder what the mechanism is, and if the community itself is at least self-organizing and recognizing that, that's encouraging. Do you, as Gatehouse, I know there have been some recent organizational changes, and you might want to speak to that a little bit. I know Gatehouse has in the past been involved with the Continuum of Care. Are you still involved with the Greater Nashua Continuum of Care, and are you involved with the substance use misuse Continuum of Care organized by the mayor's opioid? It's not the mayor's opioid task force. They changed the name, but I forget what it is.
So I believe my COO, Mitch Pierce, was the one coming to all of these meetings. I did ask if I could start joining them because I'd love to just kind of be, a fly on the wall and hear what's going on. I did bring with me tonight, I don't know if you guys want to talk about this or not, but it was basically a proposal for homelessness and substance use disorder. It's the exact proposal that I used up in the city of Manchester, but this is a pilot that we started last year, and it's been working very well, and they actually just signed on with us to do a second round, so it's now 120 people. And we do a lot of work with the city's director of homelessness. I know she's collecting a ton of data from our information, and then she brings it to the initiatives and the different collaborations and kind of shares it with them as well. I don't necessarily go and sit in on those meetings, but she is there to do that.
Is that the Gatehouse treatment triage, or is that the
so
Manchester Outreach Highlights?
This is, it's called the TST, so it's basically, it just stands for Triage, Stabilization, and Transition. And it was something that I kind of thought up. So I've been doing outreach, homeless outreach specifically, for about the past 6 years. And in the city of Manchester, just because it's close to my home, that's one of the places I tend to land a lot. There's about 536 homeless individuals up there right now. Over just one of the years, in 2021, I was doing a pilot, and I was able to pull 76 people off the street and put them into housing.
Nice job.
And that happened in an 8-month period of time. So it's tiring. There's a lot of work and effort that go into it. It's not typical that you walk up to somebody and in the first 10 minutes they tell you they want to end their homelessness and end up in a house. It's a lot of, constant follow-up and just being in front of them. But if you do it in the right manner and you use sometimes your own personal life experiences, you're able to help people kind of break down those barriers that stop them from trusting others, or just kind of that fear that they have in place of, what if my life gets better today? So I did bring that for you guys to check out. And then there's another packet that just has all of the statistics. So it says the homeless outreach highlights. And this is direct data from our pilot that we did, the first run of it. The initial 60 people that we were able to get off the street turned into 124 people. And of them, there's 25 that have been placed into housing, so they're no longer experiencing homelessness. And then there's another subset of individuals that are still currently enrolled in a PHP or an IOP program. So in my opinion, they are not homeless, they are in an actual program at this time. But some really important statistics from that is, of those 124 people, there were 23 of them that were all on probation and parole for various acts of, theft or anything that really was related to them misusing substances. So they committed a crime because they were trying to get money so they could cover the cost of their substance use. And to me, I thought that was really important information to have, because by getting these individuals off the streets and into a PHP program, and the ultimate goal is to get them into sober living at the end of the day so that they have a structured place to stay, and they can stay there for up to 2 years if it is an NH Core certified sober home. And then from there, you would hope that they'd be able to start the progression and pay for themselves to live wherever they chose.
Well, I don't necessarily want someone to be stuck with a label for the rest of their life. I do think it is helpful for organizations to, particularly if they're doing transitional housing. Transitional housing is covered under HUD definitions of homelessness, so you don't lose your eligibility for interventions or supports just because you were taken care of for long enough to become ineligible for further assistance. I know
Right.
recently in Nashua, we sort of realized that we had a giant boomerang that we threw 4 years ago, maybe 3 years ago, come back at us, where we put a lot of people into emergency housing first vouchers for chronically homeless individuals. And we managed to keep them in their placements just about long enough for those placements to fall apart, the vouchers to expire, and now they're not eligible for the level of supports that they were when they went into it. But we didn't do any of the case management outreaches or follow-ups that really needed to move them well beyond that and establish some kind of security from regression. So that's the only reason why I would say, it's helpful sometimes to identify the different criteria, but HUD has very exhaustive definitions of homeless too, which I think maybe get oversimplified by some of our daily operations people. Someone trying to fill in an HMIS entry, for example, isn't going to necessarily go down all 50 definitions to get it. But that also means we have people who would be eligible for higher levels of support than they might necessarily realize.
Mm-hmm. I agree. I mean, also, one of the things that I notice, just being somebody in the state of New Hampshire and providing this type of outreach, a lot of times, and it's starting to shift a little bit, we now have Live Free that does detox, NH detox up in Bethlehem. They'll take individuals in, but each place has a nuance, I guess you could say, right? And I hate to call it a nuance because I'm so grateful that they're actually able to take a number of clients in. But like New Hampshire Healthy Families, they don't do opioid detox. Maybe NH detox up in Bethlehem, they can't take it if it's alcohol related. And then if you don't have health insurance at all, maybe you have a New Hampshire Medicare plan. Your only option is to go to the city of Manchester and go into Farnham. The hospitals are here, they're always available, but that's not where you really
They're
want to
available.
go. But it's not where you want to go for a detox, right? And I'm going to speak from experience on this one. I went to a very nice detox about 14 years ago. I've maintained my sobriety since then, but I'll tell you, it was in a hospital, and it was not fun. You hear bells dinging all night, and you're feeling pretty sick. I mean, it's worse than having the flu, and to get no sleep on top of it. So, to me, it's nice to have an actual place for people to go and to comfortably detox the way that they're supposed to. And a lot of this all stems down to, just so you know, it ties back to the sober living, but it's very vital and important that we take the right steps. So when we meet with these individuals on the street, sometimes what happens is, if they don't have the right insurance or they can't get into a detox, maybe they're banned from all of the detoxes because of unfortunate circumstances, then we look for the next best thing. Well, let's get you into a PHP. So they go into a PHP, but you have undiagnosed mental health that is sitting there, and it's usually very prevalent, and it prevents them from actually learning and getting the services they need and that ability to comprehend the treatment that they're receiving. So what I've seen through this TST program is these individuals who would otherwise come in for PHP and leave in a week or two, sometimes even a day, we're getting them detoxed first. Then they're coming through, and we had over 30 people successfully complete PHP. I mean, I've never seen numbers like that before. And these were homeless individuals that were completing at that success rate, which is, I mean, it's mind-blowing to me when you see the difference between someone who's actually detoxed and the fact that they can come in and participate in this program, then they want to stay. And those are the ideal candidate going into sober living. And I think that's like the most important thing.
If we could touch on that a little bit, just because it came up a lot during Safe Station organization issues. We have hospitals here that have emergency rooms, but they're also chronically over populated. You could wait for 8 or 9 hours before you get seen in some cases. And then when you're evaluated, you might have actually sobered up, or you might have different issues or have just left. And then you could be looking at something like there isn't a room available, so you're going to stay in a hallway on a gurney until the one is available. So the hospital has always been meant to be like a plan C, not a plan A for people seeking recovery. We've built up different programs in the past, like Keystone and got a commercial going on here, like Keystone and other partners that don't offer the same level of intervention now. And I think the recovery community itself has really stepped forward. Peer supports through Revive, Outreach, Rise Above, Gatehouse have done a lot of engaging people and helping stabilize them, in place. Where the hospital, you would think, oh, you just go in the hospital, you come out and you're ready to go, but it's nowhere near that it's nowhere near that simple. And then you also touched on the co-occurring disorders / dual diagnosis component. I don't know if Alderman Moran wants to touch on that, but recognizing that more than one thing can be happening at a time is very important from a clinical perspective, but we don't necessarily do it from an administrative eligibility perspective. We'll identify someone as a person who's, doing substance abuse, misuse, and all that, and you see in the public a lot of people saying, well, if these people were sober, then they could go to the shelters, but they're not necessarily defined by their substance use or misuse administratively. That can be ascribed to them because of issues that they've had. And I think that's where sober housing and outreach and the engagement program that you've apparently been doing very successfully in Manchester comes into play. I mean, if we didn't have the regional housing crisis, this program that you're describing and the results you have would have been significantly more impactful. I can't commend you enough for being able to engage people in Veterans Park in this kind of a situation like that we've seen over the last 2 years and still pull out the results that you're seeing. It's amazing. We could definitely use more of it. Alderman Moran.
Thank you, Mr. Chairman. One thing to point out specifically on one of the things that you mentioned so the public hears it and understands it, Medicare, the federal health insurance for retirees and disabled people who are on Social Security disability, does not pay for detox. The only type of detox someone on Medicare can obtain, whether it's straight unmanaged Medicare, which means that you just have the Medicare card, or whether it's managed by Harvard Pilgrim, Aetna, Humana, whomever it might be, is to go to a hospital and get admitted for a detox. Locally, there's the Farnham Center, AdCare, and then there's also Emerson Hospital in Massachusetts that does that. Those are very limited accesses to so many people who have that health insurance. So, I was at a community meeting last week and I heard, why aren't they in treatment? Why aren't blah, 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 whatever it might be. Some folks may want to be in treatment, but their health insurance doesn't pay for it, or they don't have health insurance and they can't afford to pay out of pocket. There's so many barriers to treatment and care for substance use and mental health that a lay person just does not understand, and it's even more difficult to explain it because it's so nuanced. It's like, hearing Director Sullivan talk about zoning for an hour. It's so subject matter specific that it might not make sense if you don't live it every day. So there's a big need for our federal delegation to help change those rules. And then on top of it, someone might have Medicare, Medicaid, but in order for Medicaid to pay, they will only pay if that's in the fee schedule for Medicare. If it's not in the fee schedule for Medicare, it just gets denied, and Medicaid won't pay it because it's not in the Medicare fee schedule. It might be in the Medicaid fee schedule. See how confusing it is already,
Yeah,
everyone?
You have to name everything almost the same.
But it's not, it's going to say denied, not payable, and Medicaid's not going to pick up the extra cost of it. So that's just one of many barriers to treatment for anyone accessing detox care. And you might think, oh, how many retirees need any access to detox? I used to work in an emergency room as a psychiatric social worker. The answer is a lot. And then there's also disabled people who are younger. And if you're disabled, it's very common that if your life has been taken away from you where you worked for so many years and you've broken your leg and you can't go back to work, that you might fall into a substance disorder. So be mindful that there are other barriers out there besides people just not wanting to go down to the hospital and get treatment or a bed that's available. There's other barriers, and I could spend weeks discussing just this one subject.
No, you're right. I mean, in this packet for you guys, there's 44 people out of the 60 that either had Mass Health, Medicare, no insurance at all, or they had New Hampshire Healthy Families, which doesn't do opioid detox. So out of 60 people, we had 44 that would have not gotten detoxed if we didn't put together this program that allowed them to go to detox regardless. All 60 of them were detoxed because of it. And I thought that was really important because, I mean, that's 44 people we would have had out on the streets committing crimes and overdosing. I mean, the cities, I don't know if Nashua does it, but Manchester, I mean, they pay for the bodies. I mean, I hate to say that anywhere, right? But
We do
that it's
too.
a true statement. Like, why wait till they're gone to pay for them? Like, let's pay for them when we can help them.
Alderman Clee had her hand up.
Thank you. Ms. Robichaud, I truly enjoyed meeting you about a month or so ago, and I was quite impressed with the program as you explained it to us. And I know that this is a program that's actually going in Manchester, but you did talk about how you have this, if someone is calling late at night and nothing is open, that you do have this kind of housing, temporary kind of to help them and so on. And keeping with the thought about insurance, one of the things that impressed me was when you talked about how if someone doesn't have insurance, how you work with them and trying to figure out where they can go and how they can get insurance and so on. So can you kind of explain that, and also explain that if it's a late night call and you have to go and help someone, and kind of what
Yeah.
the process is. And I just, to kind of add to that, for those that are listening, Manchester does supplement this program that's in there, and I think that's a good thing. As you said, pay for the bodies while they're alive rather than after the fact. So I just want to get that out there, though. So if you wouldn't mind, thank you.
Yeah, so for anybody, if they're struggling with opioid or, it could be heroin, fentanyl, methamphetamines, cocaine, just in case somebody doesn't know these words, what we do is we're able to call into 211 together, and if for some reason maybe they didn't answer the phone, it was busy or anything like that, we have ways around that, but we would essentially call into 211 together. I'd actually assist them on the phone call. Doesn't matter what time of day it is, doesn't matter if it's at 2 o'clock in the morning. I literally work 24/7 because addiction does not sleep and doesn't take holidays. And I don't want somebody to wait until, 8 a.m. They might not make it that long. But essentially what we'll do is we'll call 211 together, and then we'll talk with the operator. She'll connect us to the after-hours clinician that's on, and then we'll walk them through the steps on how to get into either the men's respite or the women's respite. So Nashua specifically only takes individuals with methamphetamine or opioid. There can't be any alcohol or benzodiazepine involved. But in Manchester, I believe it's through the Farnham Center, they would be able to take somebody in if they did have alcohol or maybe benzos in their system. But it's still all the same process. And the biggest thing to me is that the individual that calls in or calls me, they're not on the phone alone trying to figure out what to say to the clinicians. I can't tell you how many times somebody calls me back or has called me and said, hey, I called. They told me they don't do that. They don't do what you said. So I can't go anywhere. And I'm like, no, I'm going to call with you. And then we call together, and within, minutes, they're getting picked up. The after-hours doorway or the 211, they'll actually send an Uber or a taxi to pick that individual up where they are in the state of New Hampshire and bring them to the respite. So transportation isn't an issue. If for some reason they've missed it, I can't tell you how many times I've personally funded an Uber or a Lyft myself for somebody to get to the respite house. And the respite itself, the ones we operate here in Nashua, we have a men's respite that has 12 beds, or it has 14 beds, sorry, and then a female respite house that has 12 beds. They are in separate locations, not able to give out the address, just for, if there's domestic violence or anything like that, but gender specific. And then the houses, there's typically 2 beds in each room. It's very low key. We've got like cable, Netflix in the houses. There's food being delivered every day so that they have breakfast, lunch, and dinner. We basically we have it staffed so that the individuals coming in can have it as like a safe haven. So it's a place for them to go to lay their head down, shower, eat, let their body physically rest before they either, go into detox or a PHP program or even sober living.
Just to touch on that a little bit, if people don't understand the physiological toll and the kind of psychological experience of somebody who's taking this big journey, this big step to address something that is, so much a part of their life, and starting to at least acknowledge that in some future point they're going to come to terms with all the things that they've had to do that got them to this point. Giving them Netflix is not a luxury. It's a necessity, because they say idle hands are the devil's workshop. Imagine all of the hands, and it's not idle. You're literally spending 24/7 trying to convince yourself to stay the course and not to look for any excuse such as, I'm just bored,
Right.
to not deviate from your chance. So, sometimes people might look at this, they got a cushy, whatever. Anybody who has to go through that in order to watch on Netflix, no, that's not cushy. It's a
No.
ridiculous amount of physical and psychological trauma that they're trying to process with, very cost effective. Maybe back in the 80s or 90s, there would have been a ridiculous number of magazines or books or that kind of stuff. And some places still have a lot of that. A lot of people really take up reading or knitting or all that stuff, but you have to give people things to keep themselves busy during the necessary downtime in between moments of transition.
100%. When you're going through an opioid withdrawal, just to bend your finger like that it's excruciatingly painful. We're talking people who have been self-medicating for, sometimes it's just a few years, but in other cases it's decades. So when you think about your body functioning every day on pain medication and you're using all these muscles, well, when you stop getting that pain medication and your muscles have to actually do the work and they feel the work, those withdrawals, we want to kill yourself. And I hate to say it, but that's the truth. It hurts so badly that you need some help and you need some comfort and some assistance to get you through that hurdle. Sometimes it's nice to just have the social workers that are in there or the CRSWs to talk with the clients and keep them on course, because the agony that you're going through and just the physical agony is enough to make people want to leave. Never mind the mental piece that's falling into place.
Right, I mean, so again, Alderman Moran can probably speak to this better, but it wasn't an accident that when Nashua had a safe station program, they co-located it with our mobile response program, because there was that aspect of suddenly feeling those deep emotions, feelings and all that stuff, and there's risk. You can't, I mean, people can try to do it on their own, and some people pull it off, and you have to give them credit for what they did, but there's also a lot of people who can succeed with the proper supports. Alderman Clee?
Thank you. I just want some of the data that you gave us for Manchester, it is really quite impressive. But one of the things that I had noticed also was when you gave the locations of where people had come from, the cities and so on, Concord, Derry, with the majority of them being, I think over half of them were from Manchester, but 18 of them were from Nashua. And one of the things we hear quite often from people is that, you know, we get people from all over, not just Nashua, where I don't disagree with that. I'm sure that if people know that there are services that can help them, they do want to be helped. And I do think the average person does want to be helped. So when I'm looking at this number and I see that 2 were from Concord, 2 Derry, 2 Keene, 36 from Manchester, and 18, so 50% of those from Manchester were from Nashua.
So
is that correct? Am I reading that right?
That is actually where they ended up going for sober living.
Oh, okay.
So those were people that completed the PHP and IOP course, and then they were placed into sober living. The page right before that actually has our locations of engagement. So where we were finding these individuals in Manchester specifically. So there was a number that, you know, came from just calling into our admissions line, because I was going to City Hall so much that they would start to hear it and they'd call in. Then there was the homeless shelter, which is 199 Manchester Street. The 1269 Cafe, which is a nonprofit program that's doing a phenomenal job. I mean, you'll see Bunny Supermarket, like that was a police task force called us and said they were about to apprehend somebody. Can you come down here? And we dropped what we were doing, went to the supermarket and got that person into treatment, which was great because the police are not seeing the revolving door of, let me apprehend you, let me fill out all of this paperwork, and then let's see you get released on PR in less than 3 hours. And it's terrible that happens, because I value our police officers. I mean, my husband's a first responder, so I know what they're dealing with. And that's not what their jobs were. You know, back in the day, they didn't go to school. I mean, even my husband has been a fireman for about 10 years. His training did not consist of how to administer Narcan every single day. He learned how to put out building fires and the chemicals that cause different fires. Now his job has evolved to administering Narcan every day, and the same with our police. Like, that's not what they went to school for. And to me, this is just another way to like help bridge that gap and kind of take some of that pressure off of their teams, you know.
Can I just?
Yes, but I would like to just chime in. I have worked with a lot of different people in different communities as well. And I recall as a case study, I went to Concord for my high school class reunion. I found, I think, 6 people sleeping on the steps of the State House because Concord had recently decided to clear its railroad tracks. And yeah, somewhat familiar story. And the 2 guys that were there were people that I'd worked with like 4 years ago in Nashua. And then my reunion wasn't recent. It was like 5 years ago. So more recently, I have been in contact with them in Manchester, and they're back in Nashua. But one thing that I noticed is that they are identified as Manchester referrals because it's been so long, but they started in Nashua. So it's when people talk about how Nashua is supposedly helping all these people from other communities, you know, that are coming in, a lot of them grew up here, and they've just been ping-ponged around the state looking for someone who will help them with the answer that they need. Alderman Clee?
Thank you. Again, I have nothing but kind words to say about your program. I'm quite impressed with everything that you've done. And 2 things. One is I've worked with NAMI, and I've learned from them that peer-to-peer is one of the best tools that we have. So someone that's been through it as yourself can talk firsthand with someone, and you can relate to their pain, they can relate to your understanding. But I went on a ride-along about a year or so ago with our Nashua PD, and there was someone who had overdosed, and they gave him one dosage of Narcan and nothing. Then they gave him the second dosage, and as I learned really quickly, that when it does affect them, they kind of like start up. And one of the comments that I heard from the emergency rescue people was he wouldn't go in the ambulance, he would not do anything, and they said their worry was that he was feeling so good that he would use, and it wouldn't, so he'd use more and more, and that there was a chance that he would overdose. Have you ever partnered with a PD like Manchester? I know you're in Manchester and so on, to work with them so that if a case like that happened, you could be called there to, even though he doesn't want to go with an ambulance, that you or someone from your organization could work with them? I'm not trying to put anything on it. You're doing phenomenal work, so if the answer is no, that's fine. I just
No, you're not wrong at all. I mean, so we work so close with the Manchester Police Department, and actually, the reason this entire pilot started is because I had such a strong relationship with the Manchester Fire Department, because they go on my husband's shift. He does the rescue, so they really go on pretty much every call in the city, and I would get a number of calls. And when Manchester had the safe station, once some of the respites in the local area were full, 2, 3 o'clock in the morning would roll around and they would have nowhere for them to go. So my husband would start calling me in the middle of the night and say, hey, I have these people, I need your help, can you help me? And I was getting them placed, and the chief was kind of like, how come nobody else is getting these individuals placed like this? So they just started to call me. So we do, we definitely will show up to any call that we can. We would love for the police to utilize us more, but they do have some other, there's some other nonprofit organizations too in the city that I think they partner with as well. So they've got a number of people coming in now, but I'll be honest, whatever we can do to help.
Thank you, and I know our PD does a phenomenal job, but I appreciate your answer. Thank you.
Alderman Moran?
Thank you, Mr. Chairman. Has Gatehouse partnered with the Office of Public Health here in Nashua to potentially utilize this program here in the city?
Not yet. Is that the Department of Health and Human Services?
Yes.
Okay.
Well, not the Department of Health, that's the state, but
Okay.
Public Health, City of Nashua.
I don't think so. Is that Bobby Bagley?
Yes.
So I've worked with her quite a bit over the past couple of weeks.
Talk up a little.
Sorry. I've been working with her quite a bit over the past couple of weeks, trying to really let her know that I'm here. I'm willing to help out however I possibly can. So far, I think we've done a pretty good job. I know she had a concern where she didn't really want funding to be used out of state, which I completely understand, and I'll be honest, I'm a New Hampshireite. I want to keep things in our own state, but at the same time, when I developed this whole protocol here, I started reaching out to every single detox to see who could help me, who would be willing to bring the cost down so that a city could afford this, and I got a lot of no's. The one facility is Sunrise Detox in Millbury, Mass. They were able to come down to a $500 a day private detox, which is really unheard of. And it's still to this day, they're the only ones who are willing to do it that low.
I follow up.
Yeah.
I found that an unusual barrier to have if someone's needing treatment. I used to send people that came into Harbor Care to Florida and various other places to get detox, and they always came home afterwards.
Yes.
So hearing that, I'd like to make a motion.
Okay. There's other speakers, though. Are we gonna
I,
have to-
well, we can always speak on it, but and then we can discuss it.
Okay.
I'd like to make a motion to ask the Office of Public Health, is that what it's called here?
Community Health Department?
Department of Public Health.
To partner with Gatehouse and report back to this committee on the viability of funding such a program through action by the Board of Aldermen.
Okay, well, the motion on the table is to ask them to work with Gatehouse. Just to clarify, we're a subcommittee, so we can ask. I don't see why they wouldn't, and I would be surprised if they didn't consider themselves all ready to be working, but if there's a resource, we want to make sure everybody's working together.
Right.
So I'd support it.
Can you reword that? I have to put the motion down.
So Alderman Moran, your motion was to ask the,
I would like to, so I believe through, after reading the city charter in detail, I believe we can still ask through a subcommittee to create legislation that may come back to the full board at some point. But my motion would be to ask Public Health to partner with Gatehouse and/or any other program and report back on the viability of financially funding the TST program for the city of Nashua.
I would get a little bit hung up on the idea of asking them to partner. As long as the emphasis is on asking them, I wouldn't want to try to, in a subcommittee meeting, like suddenly commit them to agreeing to whatever
No,
contractual terms.
I'm asking if they can come back with a proposal to us if it's financially feasible for the board to authorize such a program
Okay.
and fund it.
So to review the program that Gatehouse has done in Manchester, and then,
To see if that's something that we can fund here in the city through legislation.
okay.
Because we would have to authorize funding, I believe, right?
Yes.
Why don't you-
Alderman Kelly.
Alderwoman.
Well, I had a question, but I'm gonna talk on the motion. I don't think we need a motion for this. I think we can just say that the committee would like to request this. We don't need a formal motion or a vote. We've done that in the past. As long as it's just documented, we know exactly what he's looking for. We can send an email on the behalf of the committee through Donna to Public Health.
Either one works.
Yeah.
Yes.
But I did have another question, so
Please.
wanna-
You've been very patient, so.
I appreciate it. Do we wanna either put this motion to bed? If the
I withdraw my motion.
Okay, great.
If the chairman's agreeable to send that on
Absolutely.
behalf of the.
100%, I agree.
Yeah, no problem. And I think it's a really good thing to do. Absolutely. I had a question. You were talking about how in Manchester, the whole breadth of addiction was, you were able to take those people in, but Nashua doesn't allow us to do alcohol. Is that because of the programming, because of the city charter? Like, what is it that makes that limitation on the type of
For the
individuals
rest,
who can help? Yeah.
for the respite, I honestly don't know what it is within the respite contract between I think it's between the state and Gatehouse or the NH respite that we have in Nashua. I know we don't have clinicians like doctors on staff at the respite location. So I think that's their bigger concern is if it's alcohol or benzos, somebody could have a seizure or something like that and they'd end up passing away or something.
Okay.
I think that's what that part is.
If I may allow, I think Alderman Moran can clarify some of that.
So in order to have, it needs to be a medically detox facility licensed by DHHS that has 24/7 medical staffing.
Okay.
Because of that risk of withdrawal seizures, delirium tremors, and very other complicated medical conditions that happen with benzodiazepine withdrawal and alcohol withdrawal. So the respite here in Nashua is basically able to provide outpatient detox for opiate use. Because there's no substantial risk of death from an opiate, it's extremely uncomfortable and painful and miserable, but there's no risk of withdrawal seizures or other complicated medical conditions.
So my follow-up, if I could, is would this proposal that you are requesting, would that allow us to start accepting more patients along the realm that you would have? Would we actually have that clinician and all that stuff in here?
So this proposal would be to utilize, it would be two ways. And it's actually a little different and it's not all written in here. I kind of wanted to talk to you guys and negotiate this a little differently if we could. So essentially, if there was anybody who was opioid or fentanyl, methamphetamines, I'd like for them to come through the NH Respite and Gatehouse for the detox, which I think would also alleviate happening to send so many people out of state. But for the ones that are maybe more acute, like it's a pregnant female who's fentanyl or methamphetamines, I'd like to be able to divert them to the Sunrise Detox in Millbury, and then anybody who was alcohol or benzos to Sunrise Detox as well. And some of the built-in pillars that I put into place were, Sunrise actually provides the transportation right down there. And then if somebody completes, they're getting door-to-door transportation back to their respective program for aftercare. There have been a few instances where I think we had the first round, there was 4 people who left against medical advice, but even with them leaving against medical advice, they were put in an Uber and sent back to Manchester, where they landed at the doorway, and we'd intercept them in hopes to try to get them to further their aftercare. Maybe they didn't like some part of the detox, bad food, something, whatever it was, but we tried to redirect so that it wasn't just, well, now you're homeless again in Manchester. And that's what we would do the same exact thing here in Nashua, because I think that it's really important too for anybody listening that they don't think hey, Nashua's gonna take all these people, send them down to Millbury, Massachusetts, and we're never gonna see them again. No, they're gonna come back. I mean, if their roots are here, we wanna give them the supports that they have where they're most comfortable. And to send them out of state to another city would be probably worse, because they wouldn't know where they were or who they were with. So.
Alderman Kelly, any follow-up?
I'm good, thank you.
Alderman Timmons.
Thank you, Chairman Lopez. At this point, I think that the removal of your proposals is in order, because the health department is very aware of this program. I spoke to Director Bagley at length about Gate City, and I'd like her to come here and speak to the body before we do that, because I don't think she's in favor of it, and she should be the one to tell you why. So I think that would be the most appropriate thing to do at this particular time.
Right, so as a point of order, the motion was withdrawn.
Okay.
We're discussing it, and then we're just going to ask
saying
for
that
the
it was
review.
I'm glad it was withdrawn because of that reason.
Right, I don't think
So-
any of us here planned on building up a structure that our actual community health department and then
Right,
later funding has to
right.
be found. So this is
Right,
just
I
a
just want to
discussion.
make that perfectly clear, because they are very aware of the program, so.
But it really is encouraging to have an organization with a very clear vision of what this could look like, and at least some statistics on how it was actually applied, because I mean it's been a struggle. As aldermen, we don't get a lot of direct information given to the board in a formal manner on how these partnerships are developed, and I think also Alderman Moran were on the ground floor of starting Safe Station, but we weren't advising the public about it because it was being developed as we went, and we didn't want to, every time we thought we knew what we were presenting and how it was going to work, something would change, something would adjust. So committees are great for exploring options and discussing topics, but we do got to leave the work to the people who are doing it 24/7 instead of 17/7.
I agree.
Alderman Clee.
Thank you. I do understand Director Bagley's concerns, and I didn't talk necessarily at length, but I did hear some of the things that she had to say to us. But I still always believe that I think when we get everybody into a room, we can talk about certain things. And my concern, I would have said about the legislation that was possibly proposed, was that I don't think as a city we could contract with somebody without having put an RFP or something like that. So, but I think we can develop programs with people, and I think that's what Alderman Moran was kind of hoping, is that we could talk about developing programs. Is that?
Yeah, I was not
Okay.
asking to
Right. good,
contract
yeah.
with your, no
I
offense.
just
but
for
I was-
the public to hear, yeah.
I
yeah.
wanted to hear, because I
Conversation.
haven't, I've spoken to others about it, I haven't spoken directly with Director Bagley, but I wanted to hear, when it comes to funding, which is where we have the control, we clearly don't administer these programs, to know what is available if something like this were to work for the city. Because we're not in the business of managing the city departments, we're in the business of funding their programs.
It's worth pointing out also that the Division of Public Health was invited to this meeting, but we also invited them to a joint committee meeting tomorrow. So I think they're focusing on that, and they're very, very busy this time of year. They have a lot of things going on. So it's kind of understandable that they couldn't be here tonight, but it would be good to get some direct input information and to kind of see how this is all going.
Just-
Alderman Clee?
Yeah, thank you. Just a quick follow-up. It's something that I kind of mentioned before. In looking through your Manchester documentation, you mentioned that the cost to the city, I think, was approximately $5,000 per person. Is that correct? Do you still feel that's within the same range? If we were to start something here in Nashua. And I'm not saying that we are, I'm not saying that we won't, but just kind of on a
Larger
10,000
scale.
kind of level.
Yeah.
Napkin math.
So we
Yes,
had it.
exactly.
I had it broken down to, it was $300,000 in total.
Right.
So it was 200,000 to Sunrise Detox, because that was about 5,000 per person for 60 individuals. I know your population is a little smaller here, so I wouldn't know that you guys would even want to start off with 60 individuals. It could be less than that, and that's where, like, you know, I figured if we all sat down together and you wanted to negotiate things, like, we could go through it line by line and do that. But one big thing that I really wanted to point out, and it doesn't really say it anywhere on these documents, is that this program was designed for collaboration with everybody. So it's not even just Gatehouse. Like, we're not strictly tied to being the only people who can use this. We just oversee it because I'm collecting all the data from it, and then I'd be able to give you guys monthly updates so you know how many people are going through, where they're landing. But we utilized, I mean, the Doorway, CMC Hospital, Elliott Hospital, the Nashua Doorway, Southern New Hampshire. When they had a homeless individual from Manchester, they called me, and it was like instant. I mean, you're talking individuals, case managers who are sitting with the client for, you know, maybe hours making phone calls to every detox center, every PHP, and they're not getting that person in. They made one phone call to me, and within 5 minutes, that person was in an Uber and on their way to Sunrise Detox. And you don't know how many times, like, you'd hear on the other end, like, that huge sigh of relief because you have a mental health, like, clinician who's been trapped, you know? And it's not, I don't want to say that they're trapped, but they feel trapped and they feel like they're losing hope for their client. Like, how long can they sit there before they say, well, forget it, I'm so damaged, nobody will take me, and then they leave. You know, we kind of alleviated that, and my biggest thing was I didn't want it to be just Gatehouse, because I'm not selfish. I believe in us being a community. Like, how do you work together if you don't include everybody? Like, this is meant to be inclusive, so you could be a nonprofit here in the city, and if you get that person in front of you, you call us, we're helping you. Like, they're a hero at the end of the day when they're sitting across from that person, and that's what it matters, you know?
Thank you.
I think,
Alderman Wright.
I just have one.
yeah, just
One
if you could
statement.
clarify and then make your statement. I think when we started Safe Station, it was the city, the fire department, and Harbor Homes. And then the Doorway came in, and I know the Doorway now is run by Foundation, I believe. But was Gatehouse one of the partners? I know they were definitely involved in Safe Station even when that was happening.
They were part of the mayor's opiate task force and the Safe Station task force. There was representation, and they were there for aftercare for those who had, at the time, private insurance, because I believe they didn't take Medicaid at that point in time.
So we do have a substance use continuum of care that is similar to the Greater National Continuum of Care. It's overseen by the Community Division of Public Health. And they do operate in that kind of collegial manner that you're describing, where they partner with different agencies. So I think that would certainly be part of it. And I don't think I don't think that anybody would expect one organization to lift the whole issue and the whole problem. I think it would be a collaborative. But with all the models that we've done in the past, there has always been an identified leader. And that's probably the RFP process of, like, okay, who wants to take this? And what would your program look like? How would you engage everyone in doing that? Alderman Moran? Sorry.
Thank you, Mr. Chairman. I just wanted to follow up on the complexities of getting people into the detox and residential program. I can tell you it takes weeks from personal experience of getting my patients into Farnham and Keystone Hall. You know, there's an extensive packet you have to complete first. And we're just talking about just the detox. It took 6 weeks for one of my clients to get in to Farnham, and that was with being in contact with their former chief clinical officer, whom I'm professionally friends with. And then Keystone Hall, another patient, 6 to 8 weeks to get them in. It's hard to say this, but New Hampshire, when it comes to admitting people into these programs, are very, very rigid, as if, like, there's that case manager or the intake person who's not really, maybe they're seeing the person, but they're really just going check boxes, and then wait lists, et cetera. Where Massachusetts, I don't know if it's legislation or whatever it might be, but you're diagnosed with alcohol withdrawal, you need to be admitted immediately if there's a bed. If you show up on site, you have to be admitted if there's a bed, unless there's an acute medical condition. And I think that's why sometimes it's easier to go out of state, because I've had to send my patients out of state. I send people to Anna Jake's all the time. These people have resources that can get them there. But when our system is not able to maintain what we are supposed to be responsible for, I don't think there's anything wrong with reaching out to our neighboring states who have access and can support because we're all American citizens at the end of the day. Does it matter if this imaginary boundary dictates where you get the treatment? Because the person who's going through it doesn't care. They need it, whether it's in New Hampshire, Vermont, Massachusetts, Florida, wherever.
Yeah, and to double down on that, the city and state charter and constitution define people who are staying a night in Nashua as a Nashua resident. So with all of the obligations that are entailed by that. Just to bring us back to the sober housing programs, I know Alderman Klee had brought up any kind of, what does it look like if there's discharge referral, and you had also mentioned yourself that you try to give people a soft landing and all that kind of stuff. Do you take referrals from other sober housing programs in the city that might have somebody who's struggling and maybe a different program model is more effective?
We do. We take referrals from a number of the sober living right here in the city of Nashua, actually all over the state of New Hampshire. I have to say, I mean, we work with so many sober living programs here in the state. They all have like that special uniqueness about them. Some of them, you know, some of the women's programs, you have really great groups of women, strong leaders who really empower each other and build each other up. Then you have some that are a little bit more quiet, low-key, but it's all about the individual. So, you know, if I meet a person who's really, you know, they don't do well in large groups, or they're kind of shy, they don't like to talk to a lot of individuals, I automatically start thinking about my resources and where I'm going to send that person or get them on the phone to try and do an intake with. Because really, at the end of the day, it's like you're matching their personality with their clinical needs, and then, you know, just a number of other pillars. But my job is to know all of our resources and to be able to make those connections for people. So I try to get out as much as possible and, you know, be in front of everybody as much as I possibly can.
Alderman Timmons, you have your hand up, or you just?
Oh, good, thank you.
You're welcome.
Alderman Kelly, you doing anything over there?
I'm good, thank you.
Okay. All right, so if, it sounds like everybody's good, is there any final comments you'd like to make?
No, thank you so much, though, for
Thank
letting
you
me
for
come in and
coming.
talk with you guys.
This is very informative.
Appreciate it.
Thank you so much.
And before you go, we have to make a motion to accept these two communications that were received after the agenda
Yep.
was prepared.
Mr. Chairman, I'd like to motion to accept the two pieces of communication from Gatehouse for the record.
Okay. All in favor, say aye.
Aye.
Opposed? All right. Thank you for coming, Ms. Robichaud. We appreciate all your information, all your knowledge, and all your work in the community.
Thank
Yeah.
you.
Thank you for your
Same.
time, really.
Thank
And for
you.
all the almost comings and
Hey, it's okay. It just added a build up to the meeting, you know? So thank you. Thank you
Thank
guys
you.
for what you do.
All right, so next up, we have some communications. We did invite Lotus House. It was, looks like they didn't make it,
They
so
weren't able
I
to
will
make
invite
it.
them to the next meeting.
It says to recognize the urban program manager, Julian Long, for the sober house resources in Nashua, intake and program guidelines, operations, and city supports. Did you need to,
That was under presentation or discussion, but I don't
Okay.
see.
Mr. Long here?
Yeah.
Okay.
I was thinking more of the communications.
Yes, so you want me, but I'm just asking, you want me to skip these, or is that just part of what we just did here?
Yeah, I guess that's it, because
Okay.
that was what the community development division was gonna do.
Okay, Communications from Julian Long, Urban Program Manager, in regards to Urban Program Department updates, September 2023.
Okay, there was no objection, we will accept that communication and place it on file. And then this one. You have it backwards?
No, I don't have that one, do I? What is that one?
Community Development Block Grant CARES Act?
I don't have it on my list.
Okay, well,
you want
somehow
me to
my
read-
list is more comprehensive, I don't know.
Do you
if
want me
that's
to
good.
read it from yours, or? Oh, okay, you know what, it's not on my thing here, so, sorry. Sorry, communications from Julian Long, Urban Programs Manager, Community Development Block Grant CARES Act reallocation, HVAC projects.
That really sounds like what we did last month. I wonder if this is a typo.
I don't know.
Director Sullivan, do you have anything to comment on this?
The HVAC one?
Yes, good evening, committee members. Matt Sullivan, Community Development Director. I believe that there may be a typographical error in the agenda. Manager Long is not able to attend this evening's meeting, but did provide a departmental update. That was the sole communication that was intended to be passed
Right.
along to the committee. I'm happy to answer any questions about that update. I believe that the CARES Act reallocation was the precedent meeting
Right.
in September and should not apply to this evening's agenda.
Okay, yep, it sounded very familiar, so thanks for clarifying.
Of course.
Madam Clerk, any unfinished business?
None?
New business resolutions.
Yes. R-23157, relative to the acceptance of grant funds in the amount of $1,054,000 from the State of New Hampshire Department of Health and Human Services into various public health and community service grants activities. Mr. Chairman, I motion to recommend approval
Okay.
or
Is
final
there
passage.
Anybody here to speak to that? You want to accept $1 million without saying what it's for?
I am not here to speak to this, but I would be happy to try and at least answer any questions that the committee has, or certainly bring those to Director Bagley's attention. I know she wasn't able to be here this evening. As the agenda states, relative to R-23157, this is the acceptance of approximately $1 million for really 6 specific purposes as identified within the legislation itself, totaling that $1 million. Those 6 purposes being immunization generally, STD prevention, HIV prevention, TB and lead poisoning prevention fund, and immunization of COVID-19, that being a fiscal year 24 expense. You can see the state fiscal year total amounts to the right-hand side of the table that's been provided, but this is before, and this is a 5-year fiscal year grant, to be clear. This is before the committee for acceptance this evening. Again, I'd be happy to attempt to answer any questions, but would likely have to direct those to Director Bagley for more specific answers.
Mr. Chairman?
Alderman Clee?
Thank you. I do believe in the resolution itself is that table that was
That is correct.
discussed by Director Sullivan there, so I think it's pretty self-evident. And then basically looking at the fiscal note, it's just the impact is the $1 million plus grant funds to be used for those specific purposes. So I personally don't have an issue with approving this or passing this.
No, I'm pretty familiar with these programs too.
Yes.
So if are there any other comments? Seeing none, all those in favor say aye.
Aye.
Opposed? I don't even think I have to keep doing that. And then next up,
Yes, R-23-158, relative to the acceptance of $331,539 from the State of New Hampshire Department of Transportation into Transit Grant Activity, Federal Transit Authority FTA Operating Grant. Mr. Chairman, I motion to recommend final approval, or approval.
and Director Sullivan, this is what you came for?
Good evening, Mr. Chair, Matt Sullivan, Community Development Director. This is why I'm here, for this.
Now that we've used you for literally everything else.
No, that's quite all right. That's why I'm here. So this is acceptance of grant funds through New Hampshire Department of Transportation. I'm going to tell you a quick story because I've been to this group and other groups talking about transportation funding recently, and you might wonder where this piece fits in. You may even recall that at a prior hearing, when talking about our transit contract services, that I mentioned that the state of New Hampshire allocates about $200,000 annually across all transit agencies in the state of New Hampshire, and I emphasized just how small that number was. Well, as part of the budgeting process, the last state budgeting process, there was a concerted effort by transit providers, legislators, and others to increase that $200,000 allocation and provide more state transportation funding to local transit agencies to match the money that comes from the federal government. To get that federal government money, we need to have match in hand, whether from the city or other agencies. And that effort was carried through. And although we didn't get the full ask that was initially made of our legislators as part of the budgeting process, I'm happy to report that this acceptance of $331,000 represents a state fiscal year 24 allocation of $32,000, and then state fiscal year 25 an allocation to the city of $299,000. Again, this used to be $200,000 across the state. In state fiscal year, we're getting about $300,000 just for the city of Nashua and Nashua Transit. So I'd be remiss if I didn't thank our elected officials who advocated for this. But what this really means is it positions Nashua to effectively leverage transportation funding that was provided through the IIJA, the Infrastructure Investment Jobs Act, and to allow us to seek that Federal Transit Administration money and effectively implement it here in the community. This action this evening in front of the committee is simply a recommendation to accept the DOT money that was allocated through the budget to allow us to actually do that. Happy to answer any questions that you may have, but very pleased to be bringing this forward in light of prior stories that I've told to this committee.
Now, we can't turn the whole bus station into the hexagon we talked about this morning. We can do a skybridge, okay.
Unfortunately.
Just checking. This is reasonable use. Is anybody have any questions? Okay. All right, then without objection, we will recommend final passage. All those in favor say aye.
Aye.
Hi.
There's no objection, so I don't have to,
Thank you.
I was like, what are you doing?
I'm just trying to skip the second vote. Madam Clerk?
Yes, R-23-159, relative to the acceptance of $110,000 from the United States Department of Justice, Bureau of Justice Assistance into police grant activity, fiscal year 2024 hazardous device unit equipment grant. And he's been so patient.
Yes, thank you for coming. I'm sorry for making you wait.
Good evening, everyone. Kevin So with the Police Department. Yes, this grant is from the DOJ under their Burn Discretionary Grant Program. We applied for and received $110,000 to purchase 2 new hazardous device suits along with helmets and visors. The suits that we currently operate with have expired since 2020. So, yeah, this was long overdue.
Yeah.
But they're expensive, so we had to find grant funds.
Okay. Any questions from the committee?
I have questions,
Alderman Timmons?
because I love this particular officer. so
He's been here, so let's keep him.
I didn't recognize him in civilian clothes, but I do have a question. How does this particular device work? How does it look? What do you get with it?
Well, do you have it? So they're the very bulky bomb suits that you see like
yeah.
in the movies. That's exactly what that is.
Okay.
They are beyond ballistic, like Kevlar. I forget how much they can actually absorb, but these suits that we're getting are state of the art. They're more flexible, which they didn't have. Like most time you couldn't even really move your arms and stuff. So they're more flexible. They breathe better too, so the officers can stay in them longer. Same with the helmets too. It's just obviously technology just gets more advanced and better and safer for the officers. So so we have 1 bottom and 2 tops and 2 helmets with visors. that we're getting.
And can I have a follow-up?
Yep, Alderman Timmons?
Thank you. Are we keeping them here in Nashua, or are we
Yes.
gonna lend them?
Nope. So just so everyone knows, the state of New Hampshire only has 2 bomb units. One is with the state police and here in Nashua. All our equipment is for our unit. We don't lend the equipment out. So same with state police. They have their own program and they have their own equipment, so.
All right, does that satisfy your questions?
Yes, thank you.
All right, if there are no other further questions, was that a comment?
No?
Fine, okay. Without objection, we'll recommend final passage of R-23,
We have to vote.
159. All those in favor say aye.
Aye.
Thank you for your time.
Thank you.
Thank you for your
Thank you.
patience.
Say without objection, you don't have to vote no.
Oh, we don't? Okay. Okay, sorry.
All right, next up.
R-23-161, relative to the acceptance of additional grant funds pursuant to contracted amendment number 4 of the fiscal year 2024 infectious disease contract in the amount of $10,000 from the State of New Hampshire Department of Health and Human Services for the purchase of vaccines. Mr. Chairman, I motion to recommend final approval.
Okay. Any objection from the, I'm sorry, any comments or questions from the committee? Appears to be an add-on funds to programs we already run.
Yeah.
So I was a little curious. Normally I would ask Public Health if they were here, specifically what they're doing with it. But again, we're already running the program, so, and it's pursuant to a contract we already have. So, all those in favor, say aye.
Aye.
All those opposed, motion carries. Madam Clerk, any new business?
Before we get to that, Mr. Chairman, I would like to comment that in the actual physical agenda, it looks like there's an extraneous page. Just prior to this particular thing, it looks like it was the results of the election. I think it just kind of got.
We have election results on our agenda?
We do have election results on our agenda. It's always nice to get those, but it's just an extraneous. I just didn't want people to think that it was something that we were supposed to vote upon and that we have ignored it. It looks like it was probably just picked up and scanned. It's after R23-158. It's in between those two pages, so I don't think we need to address it, but I just
I'm not
wanted-
going to vote to remove
I
election
wa-
results.
I want to,
Maybe we
I
can
just want
let
to,
the
yeah, I just want to
legislative
acknowledge
assistant
that
look
it
at
was
that.
probably a mistake and that we can move on from that.
Yeah,
So-
because it's not really germane to
No,
our agenda.
no, exactly. There is none for new business ordinances?
Anything tabled in the committee?
None?
General discussion? Discussion is back and forth, and then comments, or you just say the comments, just a reminder. All right, seeing none, public comment.
No public.
No member of the public appears to be present. Remarks by the alderman. Does anyone have any remarks they would like to make? Alderman Cleve.
Mr. Chairman, again, I want to commend you for having people come and speak to us. I find it very engaging. I find it very educational, and especially considering a lot of I know there'll be more conversation tomorrow at the joint meeting, but considering the public's need for more knowledge, I think you do help by bringing these topics to it. So I really appreciate all that you're doing. Thank you.
Anyone else like to make a comment?
No.
I will announce that tomorrow we have a joint meeting of Human Affairs and Planning and Economic Development. Among the topics is we are going to try to get an update on what we're doing with unsheltered residents and how we're generally approaching issues of homelessness and who our partners are. So definitely I would check in on that meeting. Anyone who's interested in tonight's meeting, Gatehouse, a lot of really interesting information. I think a lot of us were chomping at the bit like, oh my God, they sound like they could solve things that we really want to solve. So very exciting to hear that kind of information, expertise, and results tonight. Looking forward to the conversation tomorrow, presentation more by the Public Health Department and city departments. Additionally, just an additional announcement, on Wednesday morning, we're doing a Main Street Crime Watch at Caribbean Breeze at 9 a.m. If anybody would like to come, it's mostly for Main Street businesses and residents. The public, the community health department is typically there, and then the police, and they talk not just about the law enforcement side of things, but about public safety and resources and current happenings. So again, that will be Wednesday at 9 a.m. at Caribbean Breeze. All right, seeing no further comments, can I get a motion? Alderman Kelly.
Move to adjourn.
All those in favor say aye.
Aye.
Opposed? We
8:18.
are adjourned.
8:18.
8:18.